Good morning, everyone. Welcome to our first mini Medicare training session. Today, we will discuss Original Medicare, which is something that we all need to fully be aware of as we age. This will assist with educating and answering some of our Medicare clients' questions. Trust me, this will be a high overview but informative. As I go through the presentation, I ask that you please hold your questions until the end. However, I will ask that you post your questions in the chat. If I am not able to get to everyone's question, I will compile a Q&A and post it on TB Resource website. As I promised, we're going to discuss Original Medicare and prescription drugs. Original Medicare is going to be one of our main focus. Medicare health insurance is for people 65 or older, people under 65 with certain disabilities, people of any age with end-stage renal disease, which is permanent kidney failure requiring dialysis or a kidney transplant, people of any age with Lou Gehrig's disease, which is known as ALS. And a lot of people do not look at that. They always focus on the first three bullets here. Well, guess what? We need to make sure we focus on everyone that is involved to help them. Medicare eligibility. Someone who's already collecting some form of Social Security, either through retirement benefits or disability benefits. Someone who's automatically enrolled in Part A and Part B. Once again, they are aging in. They're under the age of 65, collecting Social Security disability for 24 months. They have the end-stage renal disease or Lou Gehrig's disease. Someone that's not collecting Social Security when Medicare eligible. They must enroll through Social Security either by online by going to www.ssa.gov, over the phone by calling 1-800-772-1213, or in person at the local Social Security office. Now, one thing that I always want to make sure everyone is fully aware, Medicare is for U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years. And they have to not have a break for those 5-year period. Okay? Now, there's 2 ways to get Medicare coverage. One is that Original Medicare. That's going to be taking care of your Part A and Part B. The second one is the Medicare Advantage plans. Now, there are other items that may assist with Original Medicare and Medicare Advantage plans. And that's going to be your prescription drug plans, Medicare supplement plans, and hospital indemnity plans. Today, the 2 main focus that we're going to be talking about is Original Medicare and prescription drug plans. Now, I love to ask this question. What does Original Medicare means to you? And it can mean a lot of things for a lot of people. But I love this here. Take away my Social Security and Medicare. Guess what? Not until you pay me back every dime I paid in. And as we go through, you will see how we pay into this program. Where to start, actually? First, we need to decide how you want to get your coverage. Original Medicare is coverage managed by the federal government. Generally, have to pay a portion of the cost for each service covered by Original Medicare. In other words, Original Medicare is the traditional fee-for-service program. And that's just your traditional fee-for-service program where enrollees are served through a fee-for-service delivery system where healthcare providers are paid for each service, such as your office visit, tests, or procedures. Do I really need both Part A and Part B? Well, it actually depends on whether Medicare will be the primary or secondary issuer. Part A is going to deal with your inpatient and hospital insurance. Part B will deal with your outpatient and medical insurance. Well, what if my current employer or union group is going to be my primary? Well, guess what? You do not need either Part A or Part B. But most people choose to take Part A because it is free. Now, what if Medicare is your primary? Well, unfortunately, you would need both Part A and Part B. So, how much does Medicare Part A B cost? Well, if you or your spouse have worked and paid taxes for at least 40 quarters, which is about 10 years, then Medicare Part A is free. If you or your spouse did not work and pay taxes for at least 40 quarters or 10 years, the monthly cost for 2016 is $411 for Part A. And you can always determine your eligibility by using the calculator, which is going to be on www.medicare.gov/eligibility premium CALC. Well, guess what? Part B comes around. That monthly premium is $104.90 for most people. However, it can be higher based on one's income level. Now, Part B, your modified adjusted gross income as reported on one's IRS tax return from 2 years ago is above a certain amount. So we're going to look at the yearly income of 2014, which is going to say this is what you're going to pay in 2016. So say, for an example, you have an individual tax return that their income is between $85,000 or less. Or someone who's filing a joint tax return and their income is $170,000 or less. Filing married and separate, then the income is going to be around $85,000 or less. Well, guess what? You're going to pay $121.80. And you see throughout this chart, based on the income, how much one will pay for their monthly premium. Now, maybe you cannot afford to pay Part B monthly premium because of low income. Well, every state has a Medicare savings program that can assist with Part B premium that may also pay Medicare copays and deductibles. So, looking at the chart, you see the Medicare Savings Program. The first one is going to be your qualified Medicare beneficiary. Specific low-income Medicare beneficiary. Qualifying individuals, qualified disabled, and working individual. Well, you look at the monthly income level for an individual and a married couple. Depending on where they fall, you can see what will be covered. So, if one's income is $1,001 for the individual monthly income, the married couple monthly income of $1,348, well, guess what? They will help pay for Part A and Part B premiums and other cost sharings like your deductibles, co-insurance, and co-payments. For a specified low-income Medicare beneficiary, income levels, well, it will pay your Part B premium only. even qualified individuals. It will pay for Part B premiums only. Now, qualified, disabled, and working individual income levels, you see on an individual and married couple, well, they're only going to pay Part A premiums only. Now, this will include additional earned income exclusions. But, as we mentioned, what if I cannot afford Part B? Well, I always say if one has both Part Medicare and Medicaid, and Medicaid will actually pay their premiums. And that will pay either that $104.90 or that $121.80. What if I wait to enroll into Part A and Part B? Well, Part A is free. So you will not have to pay a Part A late enrollment penalty if you decide to enroll after you first become eligible. Now, not being eligible for a premium-free Part A, and you do not buy it when you first become eligible, then your monthly premium may go up to 10%. We'll have to pay the higher premium for twice the number of years that one could have had Part A but did not sign up. And that's where a lot of people overlook that opportunity here. So, with that being said, we want to educate our customers. Now, Part B. We'll have to pay a monthly Part B late enrollment penalty if I do not sign up for Part B when I first become eligible for Medicare or during a special enrollment period. Do not sign up for Part B when I first become eligible? Well, guess what? I will have to pay a late enrollment penalty for as long as I have Part B. So my monthly premium for Part B may go up 10% for each full 12-month period that I could have had Part B, but did not sign up for it. Also, may have to wait until the general election period, which is going to range or fall between January 1st to March 31st to enroll in Part B. And coverage will start July 1st of that year. What Part A covers? It will cover the hospital care, skilled nursing facility care, nursing home care, as long as custodial care is not the only care you need. Hospice, home health services. Part A, deductible and co-insurance. Typically, you have a $1,288 deductible for each benefit period. If you're hospitalized for days 1 through 60, you have a zero co-insurance for each benefit period. If you're hospitalized from days 61 to 90, then your co-insurance is $322 per day of each benefit period. If hospitalized days 91 and beyond, there will be a $644 co-insurance per each lifetime reserve day. After day 90 for each benefit period, up to 60 days over your lifetime. Now, if you stay beyond lifetime reserve days, all costs. Part A, deductible and co-insurance for skilled nursing facility. From days 1st to 20 days, you pay nothing for each benefit period. But if you have to stay days 21 to 100 for each benefit period, you're going to pay $161 per day. All costs for each day after day 100 of the benefit period. Now, what does Part B covers? It's going to cover your clinical research, ambulance services, durable medical equipment, which is known as DME. Mental health, which is going to be dealing with your inpatient, outpatient, and partial hospitalization. Getting a second opinion before surgery. Sometimes I recommend that for my seniors. Limited outpatient prescription drug coverage. Now, Part B, deductible and coinsurance, you have $166 per year deductible. After your deductible is met, you typically pay 20% of the Medicare approved amount for most doctor services, which is including most doctor services while you're in a hospital, outpatient therapy, and durable medical equipment. Now, you're probably saying, what is missing? What is missing from this? Well, guess what? I'm going to give you about 5 hints. What is missing? Drugs, my prescription drugs. Prescription drug coverage. That is what's missing. Well, guess what? We have to decide if you need to add drug coverage because original Medicare is only going to take care of your Part A and Part B, which is your in-hospital and your outpatient. Now, with the prescription drug coverage, which is known as Medicare Part D, this will help pay for your prescription drugs. Medicare offers prescription drug coverage to everyone with Medicare. To get Medicare drug coverage, you must join a plan run by an insurance company or other private company approved by Medicare. And each plan can vary in cost and drug coverage. Now, is prescription drug coverage automatically? I don't think so. Well, one have to decide not to join a Medicare prescription drug plan, which is formerly known as your Part D when first eligible, or decide not to join a Medicare Advantage plan, Part C, or other Medicare health plan that offers Medicare prescription drug coverage. Because if you decide not to, well, you're likely to pay a late enrollment penalty unless you have other credible prescription drug coverage or you get extra help. Now, the cost of the late enrollment penalty depends on how long you went without Part D or credible prescription drug coverage. Medicare calculates the premium penalty by multiplying 1% of the national base beneficiary premium, and for 2016 it's $34.10, times the number of full uncovered months for not having Part D or credible coverage. The monthly premium is rounded to the nearest tenth and added to the monthly Part D premium. So, to give you an example, I wish I had a whiteboard to show you this. Well, say I have a penalty in 2016 and I did not have coverage from June 2012 to December 2014. Well, my penalty is going to be 31% of the $34.10 or $10.57 each month. Since my monthly premium is always rounded to the nearest tenth, then I'll pay $10.60 each month in addition to my monthly plan premium. So, as I mentioned, it can become costly, especially when our customers are mostly on fixed income. Now, the national base beneficiary premium may increase each year, so the penalty amount may also increase each year. I don't know about you, but I don't want that. Now, there's two ways to get your prescription drug coverage. One is going to be your Medicare prescription drug plan, Part D. These plans are sometimes called PDP. It adds drug coverage to the original Medicare. Some Medicare cost plans, some Medicare private fee-for-service plans, and Medicare medical savings account plan. Your second one will be the Medicare Advantage plan, which is Part C. Now, how much does prescription drug plan cost? Good question. Well, guess what? Monthly cost varies based on one's drugs they use, the type of plan they choose. Well, guess what? The pharmacy. Is it in the network or not? Whether the drugs they use are in the plan's formulary. Or do they get extra help? Payments throughout the year in a Medicare drug plan. You got to take a look at those premiums, the yearly deductibles, co-payments or co-insurance, cost in the coverage gap, cost in to get extra help, and cost if you pay a late enrollment penalty. All of that contributes to how much my prescription drug cost will be. Now, look at the Part D premiums based on income. And this chart shows the estimated prescription drug plan monthly premium based on income as reported on one's tax return from 2 years ago and last year. Okay, so if one's income is above a certain limit, they will pay an income-related monthly adjustment amount in addition to the plan premium. So if one is an individual tax filer and they have $85,000 or less in income, or you're doing a joint income return, $170,000 or less, filing married and separate tax return, $85,000 or less, you just pay your plan premium. But guess what? If my income goes up, say 85,000, above 85,000, up to 107,000 as an individual. As a joint filer, if I'm above 170,000 up to $214,000, well, guess what? I got to pay the plan premium plus $12.70 on top of that. But guess what? Only thing I got to pay to the provider is the plan premium, that $12.70. I got to pay directly Medicare. And you can see all the other averages based on income and how it will go up. So we always want to make sure our customers are fully informed about that. Now, well, what's my yearly deductible? This is the amount one must pay each year for their prescriptions before Medicare prescription drug plan begins to pay its share of the covered costs for your drugs. Now, the deductibles vary between Medicare drug plans. No Medicare drug plan may have a deductible more than $360 in 2016. Some Medicare drug plans do not have a deductible. And I typically look for those for my clients. They're already on a fixed income. Why should they have to meet something first before the plan pays? But it all depends on what the customer wants. Now, looking at the co-payments and co-insurance, the amount one pays for each of their prescriptions after they have paid the deductible, and that depends if the plan has one or not. Some Medicare prescription drug plans have different levels of tiers of co-payments and co-insurance with different costs for different types of drugs. With a copayment, one pays a set amount, such as $10, for all drugs on a tier. Generic drugs cost lower than brand name drugs. Coinsurance means one pays a percentage of the cost, such as 25% of the drug. Now we're going to take a look at this cost and coverage gap. And I love to pull this out when I'm talking to people. In the initial coverage, this is that drug payment stage, where you pay a copay or coinsurance. The plan pays direct, and it's typically a percentage of the drug costs that the customers have to pay. And they will stay in this stage until the drug cost reaches $3,310. Once they have reached that, then they will move over into the donut hole, which is called the coverage gap. This point here, they're going to pay 45% of the cost of brand name drugs, then 58% of the cost of generic drugs. And this gives them an opportunity as well to negotiate with the pharmacy so they don't have to pay too much. They will stay in this stage until the total out-of-pocket cost reach $4,850. And typically that total out-of-pocket cost, which is called TROOP, it includes the amount you pay or others pay on your behalf towards the cost of your prescription drugs, which is going to be including the deductible, copays, coinsurance, and payments made in the coverage gaps. Premiums do not count towards the true out-of-pocket cost. Okay? Then, once this person have reached that $4,850, they will move over into the catastrophic coverage. Here, they will pay a small copay or coinsurance amount, and they will stay in this stage for the rest of the plan year. At this point, this is where the plan will pay more than the customer. Now, cost with extra help. If I got that, why I still got to pay so much? Well, a Medicare program, the extra help, is to help people with limited income and resources to pay for their prescription drug program costs, such as their premiums, deductibles, and coinsurance. Now, make sure you pay no more than the low-income subsidy drug coverage cost limits. Now, in 2016, costs are no more than $2.95 for each generic and $7.40 for each brand name covered drug. Now, when can I enroll? Well, you have your initial enrollment, and this is for newly eligible for Medicare. And they have a 7-month period that starts 3 months before birthday month, the month turning 65, and ends 3 months after turning 65. Now, if one has received 24 months of Social Security and Railroad Retirement Board disability benefits, they too have 7 months. There's a 7-month period which is going to start 3 months before the 25th month of receiving Social Security or the railroad benefits, and ends 3 months after the 25th month of receiving disability benefits. Now, if I have or have not enrolled into Part A, but enrolled into Part B during Part B general enrollment period, then you can only enroll during April 1st through June 30th. Well, you have the open enrollment, which is the annual enrollment period, and that's going to be from October 15th through December 7th. Then you have Medicare Advantage disenrollment, January 1st through February 14th. These are the times that you can enroll. Now, this concludes how original Medicare works. Medicare provides this coverage directly. You have your choice of doctors and hospitals that are enrolled in Medicare and accepting new Medicare patients. Generally, you or your supplemental coverage pay deductibles and coinsurance. You usually pay a monthly premium for Part B. If you want drug coverage, you must choose and join a Medicare prescription drug plan. I would like to say thank you, and this concludes our option one for our Medicare clients. We will pick up next week with option one with an additional coverage. So looking forward to seeing you all, and you have a wonderful day.